Hi, I'm Dr. Gerald Deas. Welcome to Health Center from Downstate Medical Center. Today we're going to talk about a blood condition. A blood condition that's been around for hundreds of years, and of course people are doing so well with it now because of certain drugs they can take that can prevent it, or not prevent it as such, but certainly treat it, and the patients do very well. Years ago, I wrote a song about, and Brooke Benton recorded, called A Black Child Who Can't Smile. And it says, have you ever seen a black child who can't give you a smile because the pains in his joints are so great? The answer is easily found when you find his blood count down because the cells that have sickled easily break. Now the child didn't ask for this when life gave him a kiss, that he would have to suffer such pain and woe. So come on, join the band, give this little black child a hand and let his blood flow, so he can grow and grow. Well, children with sickle cell anemia can grow now and can grow and grow. And it's all through research and observation of scientists here at Downstate Medical Center and other places in state and in Africa and things like this. So today we're going to just open it up a bit more for you. If you have sickle cell disease itself, or condition yourself, or know somebody who has it, you'll be able to explain what sickle cell anemia is all about. Years ago, we formed an organization called the Sickle Cell Victims Organization, and we raised money during that time, not so much to give it to research, because the government should really have enough money and university to do the research, but it was raising money for people with sickle cell anemia in case they needed to pay the electric bill, car fare, all these kind of things when they come to our clinic. In fact, we had a nice basket of fruit for them, and the parent would bring the children in, and we made it personal here at Downstate Medical Center. So I want to introduce you to two folks that are going to discuss this, and one is an old friend of mine. We've been seeing each other at least 30 years now. We don't look that old, I know, but but I want to introduce you to Dr. Scott Miller, who's nice having you here, Scott, who has done so much in hematology. But just a little background of yourself, Dr. Miller, how long you've been at Downstate, and what made you get an interest in sickle cell anemia?
Well, I grew up in Ohio and came to New York to do medical school, so it was a bit of a shock for a naive Ohio boy to come up to the Bronx and do medical school. But I finished there and did a residency there at Montefiore, and then stayed to do a fellowship at New York at Sloan Kettering and Cornell. And during my residency, I met my wife-to-be, who grew up in Queens, and basically would never leave Queens. So I looked around for a job after fellowship. There was one here. I wanted to do something that involved research and patient care. To be honest, I didn't learn a lot about sickle cell disease when I was in medical school or even residency, which is some of the problem I think we have in terms of getting people interested in taking care of people with sickle cell disease.
What year was that?
That when I started here was 1981. This was my first real job and my only real job, actually. So I've been here since 1981.
Right.
And I'm a pediatric hematologist and oncologist, and
right.
So deal with children up to age 21. Really.
I see. But what made you, when did you first learn about sickle cell anemia? Was it in medical school, or was it in your residency? Or?
Yeah, I heard about it and saw occasional people with sickle cell disease during residency, but Downstate has a long history of taking care of people with sickle cell disease. We were just talking a bit ago about Janet Watson, who was a hematologist at Kings County, and she wrote a paper in 1941 which turned out to be very important. She noticed that little babies with sickle cell anemia didn't get sickling, didn't have problems. And she attributed that to the fact that they have fetal hemoglobin. Fetal hemoglobin is the hemoglobin that we all have when we're in the womb.
I see.
And then as we're coming to term and about to enter the world, we start making normal hemoglobin in most cases. And sickle is a variant or a mutation of normal.
I see.
So at birth, 90% of everybody's hemoglobin is fetal. I start to make normal hemoglobin at birth, and And people with sickle cell disease start to make sickle hemoglobin at birth.
Oh, I see.
And red cells last 3 or 4 months. So over the first 6 months, hardly ever do people with sickle cell anemia have problems because they have so much fetal.
I see. Now, when you say anemia, what happens to the sickle cell? Does it function well? Is it destroyed time-wise quicker than a normal red blood cell?
Yeah, it doesn't circulate well. Normal cells are round, kind of disc-shaped.
Right.
And they're deformable, and they kind of slide through the little blood vessels. And a blood cell, basically, a red cell, its purpose is to take oxygen from the lungs. It picks up oxygen in the lungs, circulates around, and delivers that oxygen to all the cells in the body. Every cell needs some oxygen to run. And normally, there are very little vessels kind of at the end of the journey, and that's where the oxygen exchange can take place. And unfortunately, that's where sickle cells can sickle, and they get clogged up in the vessel. The cell doesn't get any oxygen.
Like a log jam.
Like a log jam, yeah. And the part of the body that's being fed by these vessels doesn't get oxygen, and that can cause either pain because it doesn't have enough oxygen, like a heart attack, for example, or you can actually kill the cells, and that hurts. The body knows there's a dead cell there.
Yes.
It gets the inflammatory response. It gets hot and red.
Yeah, right, surely.
Painful.
I in treating sickle cell patients myself for many years, the sickle cell patient will tell you when they have a crisis, meaning their pain and the blood vessels now are jammed with these little sickle cells as such, it's very severe. In fact, at one time they thought that when a person would come to the emergency room with a sickle cell crisis, they would think that, and they needed morphine, and that's a very heavy drug to take. But let me tell you, it was something that they had to have because the pain is so great, And they used to think that they were morphine addicts. But I can tell you from my experience, very few of them ever became a morphine addict after they got better.
Yeah, you're right. We worry about that a lot more than we should, because worrying about that causes us to undertreat the pain.
Yes.
And that's not fair. If there are some addicts, and there are.
Sure.
I don't think it's fair to punish everybody with sickle cell disease because some people have, for whatever reason, become dependent on opioids.
Yes.
95 or 99% of people who get morphine for pain don't become a drug addict.
Right.
And probably 90% of them don't get enough morphine to adequately treat their pain. So,
well, we have a patient here right now, not a patient, but a wonderful young lady, Ms. Overton, and she has sickle cell anemia. Is that right there?
Yes.
Yes. And you've been through the crisis.
Yes.
You know what it's all about.
Yes.
Yes. How often did you have crisis, and did it prevent you from going to school? Did it?
Well, this semester, because I started my college semester. Well, I started over because last semester I had crisis throughout that whole timing. From August up until September was just crisis.
Right.
And what happened was I had to withdraw from college, everything, all my classes.
Yeah.
And that affected me because, at this point I would have been I would have been ending my freshman year.
Right.
But instead I'm just starting over from scratch,
Right,
I'm just
sure.
trying to get everything done. So, and even in high school and middle school and primary school, it's I've been dealing with these conditions where I had to take myself out of school for a little bit and then start over again.
Right.
I mean, in high school it was easier though, and all the, in public school it was easier to do because, your teachers had your work from you. They probably come to the hospital and drop it off for me, and I could do it there. But college is just different because professors aren't going to maneuver their schedule the same way.
Yes.
So now it's just you're left at a point you have to withdraw from classes and just leave it at that and just start over the next semester.
Well, what year of college are you in now?
I go to New York City College of Technology,
Okay.
and I'm in the law major, paralegal studies major.
Right. Well, I tell you, looking at you, you look like a healthy young lady. And I think your personality, you know, they say a smile does a lot of things for people too, because when you laugh, there's a thing called endorphins, and endorphins releases things stronger than morphine in your body, you know, and so forth. So I always, in treating sickle cell patients when they came to office, had them do more laughing as such, you know.
I do that a lot.
It does a lot. But we're going to get back to you in a moment. I just want to talk to have Dr. Scott to give an idea of what they're doing now for sickle cell anemia.
Well, the only cure for sickle cell anemia is a stem cell or bone marrow transplant. That's still something of a dangerous procedure, but if you have certainly bad sickle cell disease, if you're a child, preferably, and if you have a full brother or a sister who matches, and there's a 1 in 4 chance that a brother or sister will match,
Yes.
then you can do a stem cell transplant or receive a stem cell transplant, still with maybe a 5% chance of dying of complications within the first 3 months, maybe another 5 to 10% chance of rejecting the transplant or sort of going back to having sickle cell. But 80% of the time, you don't have sickle cell disease anymore.
That's wonderful.
So you're trading off some risks at the beginning for perhaps a disease-free, long, pain-free life. So I think it's reasonable for many people with sickle cell disease, especially if they have a matched sibling. They're trying to do transplants using either people who are unrelated but have similar genetic types, or even from a parent, for example, who's only half matched genetically.
I see.
But those are more dangerous, and I think that you should be having a lot of trouble with sickle cell disease before you take the risk of one of those more experimental transplants.
Right. Now, tell me this.
But,
I'm
sorry. So, at any rate, that's the cure. Very few people are transplanted, in part because they don't have a matched sibling. And to me, hydroxyurea, a medication that was discovered to be useful in sickle cell disease, I think back in the 60s, and after a big trial which showed it to be very effective in adults, it was licensed by the FDA for use in adults with sickle cell disease to reduce the frequency of pain and pneumonia, basically, by about 50% in a big study that was done by the government. We've been using that medicine in children with sickle cell disease since, I don't know, sometime in the 90s, probably the early 90s, really with progressing enthusiasm. We joined in a study in infants with sickle cell disease.
I see.
Sponsored by the government. There were 15 sickle cell centers in it. 200 infants, where half of them got hydroxyurea, half didn't. And it was enormously effective in reducing side effects, if you will, of sickle cell anemia.
Now, when you use that, maybe explain the drug a little, the hydroxyurea. When did that come into play? In what year about? You know, because of course, before that, there was really no way in the world to treat sickle cell.
I think it was in the 60s that I mentioned Janet Watson and fetal hemoglobin. Once people realized that fetal hemoglobin was good for people with sickle cell disease, some people started to look for ways of raising fetal hemoglobin.
I see.
There are a number of chemotherapy drugs that were shown to raise fetal hemoglobin levels. The chemotherapy, one of the bad side effects is it will lower blood counts because it damages the bone marrow. And the theory is, and I don't think anybody is exactly clear on why it is, but after chemotherapy, as the bone marrow recovers, bone marrow is where blood is made, as the bone marrow recovers, there's a fetal hemoglobin production that doesn't happen at other times. And it turns out that fetal hemoglobin production can be sustained with hydroxyurea specifically.
I see.
Which is a chemotherapy drug, but it's one of the safer. It's given by mouth once a day. It's one of the easiest to give. And that kind of led to trials in hydroxyurea. I mentioned the adults in the 90s and the babies that was published in 2011.
Right.
And it extends life in adults in addition to reducing pain. I think, personally, every person with sickle cell anemia should probably take hydroxyurea.
Well, you know, a lot of experimentation was taking place, of course. Maybe before we get into our, well, maybe I'll get right to you again, Ms. Overton. Anybody else in your family with sickle cell anemia?
No.
No.
Well, my mom has the trait, but no.
Yeah, because as you walked in with Dr. Scott Miller here today, I said, you look well. You know, are you having many crises now?
No.
Uh-huh. We'll get into that in a minute.
Okay.
Because I know when talking about going to college and things like this, I had so many sickle cell patients who had to stop studying because of the crisis that they would have. But now they finish college, they get married, and they do all the things that are generally a young person would want to do, you know. Dr. Miller, when you get back to that again, maybe just give a description of how long a red blood cell is formed in the bone marrow and how long does it usually last in a normal person in circulating and doing its work?
You can go up and down depending on need a little bit, but the normal blood cell starts as a very primitive precursor and matures and divides, etc. And that takes about a week or so in the bone marrow. And once it gets out, it circulates for 120 days, or what's that, 4 months. People with sickle cell disease, again, because the cell is distorted in its shape, it doesn't flow properly, it doesn't circulate normally.
Right.
Those can only survive a couple of weeks sometimes.
Well, where's the cell usually, what organ in the body usually will take a sickle cell out of circulation before it gets back into circulation?
Well, the spleen is the one that's supposed to do that. People with sickle cell have a very early problem with the spleen because not only does it remove cells, but it removes them by sort of setting the cells up, by pooling them up in these sort of sinuses in the spleen. And sitting is a bad thing for sickle cell. So the cells tend to sickle in these sinuses. And splenic injury occurs very commonly in the first year of life, even in sickle cell disease. Yeah. And by 5 years of life, the spleen doesn't work anymore in 90% of kids with sickle cell disease.
Yes.
So the red cells don't last much longer even without the spleen in older people, and so the liver can take some out, I guess, lymph nodes. And so you still have the problem with the short red cell survival even after the spleen, and most people with sickle cell anemia is no longer functioning.
Right. So then, now in your crisis, when you do have a crisis with sickle cell anemia prior to now maybe feeling better, since we're going to be talking about that certain drug, could you describe the pain?
The pain? I get this question a lot. People always ask me like to describe what it feels like. And it's just like, it's unbearable. Like, I can't, it's like actually going through the pain.
Yes.
It's like it hurts so bad that it's like you have to stay still and not move. So,
right.
But then it's like you move anyway because it's like, it's basically like you're torn. Like,
sure.
And like the pain for me is like getting hit with like a hammer. Like
Wow.
it's terrible. Like I can't really explain it. Like I don't, personally I don't know what it's like to get hit by a hammer, but like that's the only thing that people actually can relate to, like.
Yes.
And honestly, like I really don't know how to explain it. It's just a really unbearable thing. It's severe and it just hurts so much.
And how often would you have a crisis?
Well, I mean, yeah, maybe when I was younger, I had it a little more. As I got older, like until like last year, it happened a lot. But I don't really have it as much
now.
Yeah.
And of course, you say you've been attending college, and when you have these crises, there's no way in the world to be able to study when you have that kind of pain.
No.
Yeah. So you'd have to drop back in college. But what were you studying?
Well, my major that I'm in paralegal law. So I'm basically like studying to become a paralegal, to become a lawyer.
Oh, wonderful. Okay.
Yeah.
Well, that's wonderful. Well, I tell you, just the way you look today, and we'll get to why you're looking this way today. Dr. Miller, how long you been seeing Dr. Miller?
I've been seeing Dr. Miller since 2009.
Okay, and I'm sure you feel blessed.
Yes, I do.
You never told me that before.
Dr. Miller, maybe we get to this hydroxyurea thing now, and it's you said you have done some work with it, and patients have proven to have less crisis, or at least painful crisis, since they've been put on this medication.
Yeah, if they take it, I heard, I haven't seen it yet, but I heard today that there's an article in the Journal of the American Medical Association that somehow determined that only about 15% of adults with sickle cell anemia who likely would benefit from hydroxyurea take it. And it's been something of a mystery around that for a long time, because it's a wonderful drug, as I say. Not 50% reduction in pain when it's pain like that is a significant reduction, and throw into that the fact that based on the adult study that was done in the 90s, although they stopped that study after 18 months, it was supposed to be a 3-year study, they stopped it because the end point of the study was, does hydroxyurea reduce pain and pneumonia? And they reached that endpoint in half the time they thought they would. But they allowed, they being the government, allowed the people who were running the study to keep following the people who had been in the study. And they were told the results that hydroxyurea reduces pain, and every adult at least should take hydroxyurea if they have bad sickle cell disease. But some did and some didn't. And there was a paper written after 17 and a half years of follow-up after the beginning of the study.
Right.
And I don't want to alarm you, or did I tell you this already? But nearly half of the people that were on the study had died of sickle cell disease. And 85% of those deaths were in people who either never took hydroxyurea or took it for less than 5 out of the 17 and a half years of follow-up.
Oh, I see.
And I project this slide when I give a lecture, and there's a graph that shows survival, or death, actually.
Right.
And there's a group of about 20 people in this study who took hydroxyurea for at least 15 of those 17 years.
Right.
All 20 of them are alive.
Yeah, well, that's
And
really...
I think that's very telling. And
it is. That's
and now that we have shown that it's safe, at least, and effective to give to infants, everybody doesn't think like this, I don't think, but it's very reasonable to me to put even an infant on hydroxyurea, maybe even before they have problems.
Yes.
As I said, the spleen goes early. 30%
Yes.
of infants have their spleen injury by a year of age.
I see.
So,
Well, I can tell you, seeing your patient here now, and have you found that while you've been on the medication, hydroxyurea, have you had less crisis or less time that you spend in the hospital?
Yeah, since taking it like from 2009, there has been times where I was not in the hospital for at least like 3 years.
Yeah, well, that's a blessing, because like you say, we don't know what each body is like. And is there any particular diet that you have adhered to, or no, you look like you're very healthy. If anybody saw you walking down the street, they say that's a healthy young African American young lady. Is there any diet that you subscribe to at the present time, or that you're taking? Are you on, like, do you eat meat, or do you eat a lot of vegetables? There's all this thing called a Mediterranean diet, as such.
Well, I don't, there's no specific diet, but every so often I will eat like fruits and vegetables, or if my mom cooks dinner, like she'll have like vegetables at the side, and I'll try to take like more vegetables and have it in my plate and eat it, but there's no really specific thing. I drink water, every so often.
When you say so often, how many times a day do you drink a glass of water?
Well, 3 days a week, twice a day.
Well, I can tell you.
I only drink water 3 days a week.
But diet has a lot to do. We're going to continue with this discussion right now because time is our enemy, and I hope that we can continue right now because we want to make sure the audience understands what is the revolutionary thing that has taken place where we understand this condition where a person can have a normal life. I've had young people in their 40s now and things like this, and 50s. I have patients who have been on hydroxyurea for a period of time and just they're doing very well with not going to the hospital anymore, things like this. So we want to make sure that the audience that is looking at the show might have sickle cell children or sickle cell anemia, that here we're on the verge of possibly having a person have a normal life, and without the pains and things like this. So, Dr. Scott, and treating her, how often do you have to see at the present time?
When we start hydroxyurea, we like to see people every month. One of the benefits probably of hydroxyurea is it lowers the white cell count, but that's also a side effect, and if the white count goes too low, you can be in trouble in terms of extra infections and whatnot. Well, so we see people once a month to check their blood. Well,
I can tell you, you folks out there, we're going to further this discussion on sickle cell anemia and the advances that has been made. We'll see you the next time.